Are hypnagogic hallucinations a sign of mental illness? Have you ever felt like you were dreaming while still awake? That strange sensation is known as hypnagogic hallucinations. So, are these experiences a sign of mental illness? Let's break it down. Hypnagogic hallucinations happen as you are falling asleep. They can include vivid images, sounds, or sensations that feel very real. However, they are actually created by your brain during the shift from wakefulness to sleep. From a sleep wellness perspective, hypnagogic hallucinations are usually considered normal. Many people experience them occasionally, and they are typically harmless. They do not usually disrupt daily life or suggest an underlying mental health issue. However, these hallucinations are more common in individuals with certain sleep disorders, particularly narcolepsy. Narcolepsy is a neurological condition that leads to excessive daytime sleepiness and sudden muscle weakness. People with narcolepsy often experience hypnagogic or hypnopompic hallucinations, which occur when falling asleep or waking up. In this case, these hallucinations are part of the sleep disorder and not a sign of mental illness. It is essential to differentiate hypnagogic hallucinations from those related to mental health disorders. For example, in schizophrenia, hallucinations are mainly auditory, like hearing voices. These occur while a person is awake and are often accompanied by other symptoms such as delusions or disorganized thinking. In contrast, hypnagogic hallucinations typically happen only as someone is falling asleep, are often visual, and the person usually knows they are not real. Sometimes, hallucinations can appear in other mental health conditions, such as severe depression or post-traumatic stress disorder. However, in these cases, they are part of a broader range of symptoms and not limited to the sleep-wake transition. For children and teenagers, hypnagogic hallucinations can be frightening. They may confuse them with nightmares or panic attacks. In young patients with narcolepsy, these experiences are relatively common and can cause distress, leading to fear of going to sleep. In summary, hypnagogic hallucinations alone do not indicate mental illness. They are often a normal part of the sleep process or linked to sleep disorders like narcolepsy. When they occur without other mental health symptoms and only during the transition to sleep, they do not point to a psychiatric condition. If these experiences are frequent, distressing, or come with other symptoms, it is a good idea to consult a healthcare provider who specializes in sleep wellness.